In today's video, I'm going to show you a very powerful exercise for treating your low back pain and sciatica, and it's an exercise that you can do anywhere. I'm Schroetke, Doctor of Physical Therapy with Physical Therapy and Hand Clinic of Hillsboro, and today I'm going to show you an exercise called Flexion in sitting. And this is a great exercise if flexion works for you because you can do it anywhere, even when you're at work in the office. Before trying this exercise, you should have already tried flexion in lying, and you should have found that it works for you. So if you've done flexion in lying and it helped resolve some of your symptoms but not fully, or if it helped quite a bit but you just can't do it at work because you can't drop onto your back and start pulling your knees into your chest while you're at work, well then this exercise should be perfect for you. In order to do flexion in sitting, you do need a piece of equipment. You need a chair. That's why this is so great, because you can do it anywhere. You can do it at work. So no excuses when you come into the clinic and you tell me you weren't able to do your exercise because you didn't have the equipment. Ideally, when you set yourself up for flexion in sitting, you have the chair height adjusted so that your hips and your knees can both be bent to about 90 degrees. If it's not exactly 90, if you're a little below or a little above, don't worry about it. It's still going to work for you just as effectively. My chair height is set up so my hips and my knees are both bent to about 90 degrees. Just scoot out toward the edge of the chair. Our feet are open a little wider than hip width. That's just to accommodate our head going down between our knees. I'm at the edge of my chair. Knees are about a little wider than hip width. We're going to reach through our legs, down, 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 hold 1 to 2 seconds, and back up. I'm going to do this in a rhythmical fashion. Down I go, hold 1 to 2 seconds, and then back up. Each time trying to go farther into my range. Remember, end range is where the magic happens. Down I go, and then up. If you're doing this, and it's helping quite a bit, but you're not getting a full resolution of symptoms, or if you're not quite getting to end range, and those two are often synonymous, then you're going to want to add a little overpressure. So to do that, down I go, and you're going to grab the chair legs and just lightly pull yourself farther into your range. You're not pulling hard, you're just trying to go farther into the range. Down I go, grab the chair legs, and just gently pull. You'll feel yourself move farther into flexion. If you don't have chair legs that you can reach, or it's a chair that doesn't really have chair legs, then you can grab the backs of your ankles. Same thing, down I go, pull 1 to 2 seconds, and then back up. With all of these exercises, you're always going to want to test how you feel when you're done. So don't just sit there. Get up, walk around. Does it feel better when you walk? Does it feel better when you stand? Does it feel better when you get up from a seated position? If so, that's a very good indicator that this exercise is appropriate for you and that it's going to help you get better. If it made you feel worse, then you're going to want to try something else. You might go to extension and lying, which is my personal favorite, and which does tend to be the most beneficial for most people. The dosing for flexion in sitting is 5 to 10 repetitions every 2 to 3 hours, or as needed for pain. And I always add that or as needed for pain, because if you do this exercise and you're pain-free for 4 hours, then I would do it every 3 to 3.5 hours. Or if you do this exercise and you're pain-free for, say, 2 hours, then you're probably going to want to do 5 to 10 reps every hour. But do it consistently at the dosing that works for you. And over time, that's over a matter of a couple of days, that window of you're feeling better and pain-free is going to get longer and longer and longer till you get to the point where you might not even need to do this exercise on a daily basis. You might only need to do it 1 or 2 times a week, or not at all. I'm Schroetke, Doctor of Physical Therapy with Physical Therapy and Hand Clinic of Hillsboro, showing you how to do flexion in sitting. If you like what you've seen, subscribe to our YouTube channel and make sure to click on the little bell so that you're going to be notified each week when we upload a new video. Like the video, share the video with your friends, and leave comments below. Let us know if you've tried this exercise and if it's helped you, or even if it hasn't helped you, because if it hasn't helped you, we might be able to steer you to an exercise that's more appropriate for you, or we might be able to suggest a modification for this particular exercise that gives you more benefit.